everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be discussing Narcissistic Personality Disorder. So let's get into it. I do want to mention the word narcissist or calling somebody a narcissist is pretty commonplace these days. If somebody you think is like maybe arrogant or maybe a little bit self-absorbed, you might say, oh, they're a narcissist. But what we're talking about today is an actual medical condition. This is an actual mental health condition, and we need to make sure that we're separating the medical side of it from the kind of like societal use of that word. So today we're talking about the medical side of that word. So Narcissistic Personality Disorder. It is a cluster B personality disorder, so it is characterized by things like being dramatic, emotional, or erratic. The biggest risk factors are being male and in your early adulthood. This is when it's most often diagnosed. And then the causes could be genetic, could be related to childhood trauma. And then there are some suggestions about culture can have a role in this. So an example they like to give is somebody who grew up in a big city that was very competitive all their life to somebody who grew up in a small town with not a lot of people. So the big city person is at higher risk for having narcissistic personality disorder. Narcissistic personality disorder is one diagnosis, but there are subtypes underneath of that, and I wanted to identify those. So the first is overt. So this is probably what you think of when you think of a narcissistic person. Sometimes this is even referred to as like classical narcissism because it's the main definition. So somebody who has overt narcissism is going to be very focused on themselves and power and success, maybe even wealth, okay? That's very important to them. And because they think they've earned it, they think they deserve it. There's a sense of entitlement there. But they also do care very strongly about the opinions of others, so how they are seen or perceived by other people. So even like the slightest criticism can be detrimental to them. That could be very, very upsetting to them. Another type that's not as obvious is the covert or closeted narcissist. So these patients have an inflated sense of importance, and they see themselves as a victim, okay? So what happens in this situation is they want attention. They want all the attention. And the way they get the attention is by being a victim, by blaming and shaming and manipulating other people into feeling sorry for them. So that's a little bit different, right? Those are a little bit different. The antagonistic narcissist is very competitive and arrogant, and they need to be number one at all costs. So that doesn't matter if I have to cheat to do it, if I have to start a fight just so I can win the fight, it doesn't matter. They have to be number one all the time. Very, very competitive. The communal narcissist, this one might be even less obvious, I think, than some of these other ones, because these are people that come across as very nice people, very selfless, or even martyrs. So these are the people that do charities, right? These are the rich people that make these big charities, and you think, oh my gosh, they're so wonderful for helping all these people. But the reason they're doing it is for the attention and the accolades, not because they actually care about the cause. It's because they want the attention. They want to be seen as selfless and as a martyr. So that one can be a little bit more sneaky, in my opinion, than even the covert narcissist. And then finally, the malignant narcissist. So this is somebody who has all these other characteristics, you know, the self-importance, the entitlement, the arrogance. They have all that. But they also have traits similar to antisocial personality disorder. So I'll do a whole nother video on that specifically, but some common things include aggression and paranoia. A mnemonic you can use to help remember the signs and symptoms of narcissistic personality disorder is a fame game. So A is for arrogance, right? That's the first thing we think of. F, fantasizing about unlimited success and wealth and power and brilliance and beauty, all of these things. Admiration is required in excessive amounts, so I need a lot of positive attention to make me happy. That's what that means. They can be manipulative, envious of others and lacking in empathy, feelings of grandiosity, so self-importance, I'm a big deal. A, associates with what they perceive to be special people or even institutions. So they are friends with these people or associated with these people that they think are important, and they think it makes them look important too. Or institutions as well, being associated with, I went to Harvard and I got to tell everybody I went to Harvard because that makes me special. That kind of thing, okay? So they need to be associated with things that are seen as special because it reflects on them. This kind of me first attitude. And then our final E is for entitlement and exploitation of others. So how is this diagnosed? Well, first they're going to look at your signs and symptoms, but then the big diagnosis comes from looking at the DSM-5. Just like most mental health disorders, this is kind of the gold standard that they reference to make these diagnoses. So you have to meet these criteria. It has to be chronic. It has to have long-term impairments in your functioning, so both like your social life and your work life. It has to be pathological in nature. And it can't be attributed to other things, so it can't be other causes. Things like substance abuse or your developmental stage, like adolescence. It can't be contributed to physical things going on with you, other chronic health conditions. It has to be specifically this, so they can say, yes, this meets the criteria, this is narcissistic personality disorder. And then what do we do about it after our patient has been officially diagnosed? So the standard of treatment is lifelong therapy. So counseling is going to be goal number one. And then sometimes these patients also do get medicated. So things like antidepressants, mood stabilizers, and antipsychotics can sometimes be prescribed. I do want to point out a big issue with treatment is they don't really seek treatment very often. Usually they're not even aware that there's a problem, right? Because of the nature of this illness. So other people in their lives are usually the ones to point it out to them like, hey, I think you need to go to a doctor. This is not a normal way to behave. There can also be a reluctance to seek treatment for those who know they need it because of that, sense of, I can't take criticism. So a therapist, oh no, I can't handle that. So that can be a problem too. And narcissistic personality disorder, it affects your life in a very negative way. It affects your social relationships, your work relationships. It can lead to substance abuse. It can lead to depression and even suicidal thoughts. So it is something that we need to take seriously. It is a serious medical condition and not just, like I said at the beginning of the video, just a common phrase we use to insult somebody these days. So making sure we know the difference is important. And that was my video on narcissistic personality disorder. I hope you found it helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.